Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio is Barb Dehn. She's a Bayer spokesperson as well as a women's health nurse practitioner, a nationally sought after speaker in women's health, many outlets, including CBS, ABC, CNN, and many more. She's an award-winning author and holds a bachelor's in science from Boston College, earned her master's degree at the University of California, San Francisco, and now here on Health Professional Radio. How are you doing today, Barb?
Neal, I love talking to you. This is great. Thanks for helping us spread the word about better health.
You know, that's what we're about here at Health Professional Radio, is spreading not only better health being extremely important, but avenues where we can achieve better health, much better health, especially now. Now, you're a women's health nurse practitioner, a women's health expert, and also an expert in the healthy reproductive system. Could you talk a little bit about how you became such an advocate of healthy reproductive systems?
I started my career in pediatric intensive care at Stanford, and I saw a lot of children who had health issues that I felt could be prevented by better prenatal care. So I became passionate about doing women's health and prevention. So I'm all about prevention and keeping healthy people healthy, and then promoting better health in people who want to make healthier choices in their lives.
Now, as a spokesperson for Bayer, how much time do you devote to speaking to college-age women about the importance of staying on top of their reproductive health, in addition to all of the other appearances and lecturing that you do?
Well, I find myself talking to patients every single day, and if it's not a patient, it's a friend or a friend's daughter, or my son is in college, and so I often get calls from some of his friends at the University of Oregon. So I feel like I'm talking about birth control, reproductive health, staying safe, making good choices to millennials and women of college age almost every single day.
Don't young women get kind of an extra boost as far as motivation and education when it comes to reproductive health?
Young women really do, because most of them are very concerned about controlling their fertility and planning when is the best time for them to become pregnant. So many young women will access health care because of contraception, and many are very surprised to learn that there are new long-acting reversible contraceptives. They're known as LARCs. These include implants and IUDs.
So these are developments that a lot of women aren't even aware of, these long-acting, and you say reversible contraceptives. You mentioned implants. There are implants that can be implanted and then removed, and the conception can be achieved?
Neal, you're exactly right. So implants and intrauterine devices, or IUDs, are reversible. That means that they can be inserted and then removed when a woman decides that she wants to pursue fertility or getting pregnant, or some of them are good for 3 years, some are good for 5, some even as long as 10 years. So women then can make decisions about when they want to start their family. And what's really nice is that Skyla is a new long-acting reversible contraceptive. It is made by Bayer. It's good for 3 years. And when women want to become pregnant, they can remove it. In fact, 3 out of 4 who wanted to become pregnant were able to do that within the first year of removing Skyla.
Now, what about the cost of Skyla, for example? Is it covered completely by most insurance, or as far as, putting the implant in and taking it out? What about the cost?
You know what? That's such a great question, because now with the Affordable Care Act, a lot of women find that their contraceptive methods are either fully covered or mostly covered, and their co-pays are much less than they expect. Everybody's insurance is different, and so I would advise women to check with their own insurance company, but you may be surprised to learn that your contraceptive method, whatever it is either fully covered or mostly covered, and your copay is a lot smaller than you think.
Now, do you see a total shift from the old type of contraceptives, the pill and whatnot, and these new methods? Are they being chosen much more than the old methods? Because if you decide 2 years into a 5-year contraceptive treatment that you want it taken out, Is that an option, or are you locked in for the duration of the treatment?
Whenever we counsel women about the risks and the benefits, the pros and the cons of any contraceptive method, this is a question that always comes up. Can I stop it? Can I stop it at any time? And the good news is that with the implants and with the intrauterine devices like Skyla, a woman can have it removed at any time that she chooses. And the contraception is completely reversible. So she can go on to try to become pregnant if that's what she chooses to do. So women are never, ever locked into these methods.
Now, as far as them being reversible, are we talking about immediate reversal upon removal, or is there a waiting period maybe for the chemical or the treatment, whatever it may be, to leave the system? Is that something that needs to be taken into consideration as well?
It is something to consider because it's not an issue for Skyla. Skyla has it's a hormone-containing intrauterine device, and it contains progestin. And what's good is that as soon as it's removed, a woman can try to become pregnant right away. So there's no waiting period. And so when we talk about completely reversible, it's completely reversible. Once it's removed, a woman can try to become pregnant right away if she wants to.
Now, as a spokesperson for Bayer, can you recommend the better contraceptive as opposed to, one as opposed to another? Or is it based on every woman's decision or every woman's body or situation?
Neal, so many times women say, well, what is the very best contraception? And that is such a personal and individualized choice. Every woman is different. Every woman's situation, her history is completely different. The best person to talk to that or speak to about what each woman should do is her own healthcare provider, because each woman wants to go over all the risks and the benefits, pros and cons, how long she wants contraception for, and what is really best for her body. So absolutely one size never fits all, and it's best to have that conversation with your own healthcare provider.
You're also an author, the author of Nurse Barb's Personal Guide to Pregnancy, also Nurse Barb's Personal Guide to Breastfeeding, as well as the Hot Guide to a Cool, Sexy Menopause. How long have you been an author, and where do you find the time being a nurse practitioner?
Gosh, Neal, I started writing in 2004 because I was getting the same questions all the time from my patients, and I thought, well, let's put this information out there so that women can access it. And my goal is to empower women and families with information so they can make the best choices for their own health care.
And you also have a website where more information about you and your practice, as well as some information about Bayer, is available.
I do have my own website. It's nursebarb.com, and on there you can find information about birth control options, pregnancy, breastfeeding, everything, but also colds and flus and caregiving. It's a good place for good information that helps everyone make better choices to be healthier.
Nursebarb.com, and not only reproductive health, but good health in general, yeah?
I hope so, because so much of women's health has to do with caregiving, caregiving their family, caregiving children, but a lot of it, especially for millennials, has to do with staying up all night, studying, staying safe, good nutrition. It all plays a role in women's health.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Barb Dehn, Bayer spokesperson and women's health nurse practitioner. We've been here discussing the importance of young women staying on top of their reproductive health, as well as talking about some of the new advances in contraception and also the accessibility and affordability of these new developments. It's been great having you here with us today, Barb.
Neal, it's always a pleasure talking with you. Take care.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.